expanded range of services. What all the services are available in this AAM includes, there are mainly 12 types of health services are available. First one is care in pregnancy and childbirth. So I want to mention here, it is only very simple word, care in pregnancy and childbirth, but there is lot of services belongs to this maternal and child health. So firstly, all ASHAs they used to maintain a record called EC register. Am I audible to all? If I am not,
Yes,
please
sir.
let me know, madam.
Yes, sir. You are
So
audible.
MCH services, ASHAs. So field level grassroots workers are the ASHA workers, because so either 2, 3, or 4, or 5 villages belongs to one ASHA. So what they will do means, they will collect the information from the community. For example, if any marriage happened, they used to register that couple name in EC register, that is eligible couple. So from 18 years to 45 years, who are not undergone for any tubectomy or vasectomy will come as EC eligible couple. So who are eligible couple register, they will maintain. So what they do, they used to contact ECs, they will ask for the LMPs, that is last menstrual period. So if LMP is more than 1 month 7 days, or more than 1 month 10, or 2 months, most of the time it will not take up to 2 months, unless until negligence from either both sides, from mother side or from Asha side. So 1 month 10 days itself, the Asha will do UPT test, which is carried by ASHA workers. So at home level or sub health center level, they used to do. So once the mother is confirmed with UPT test, we register with a before 12 weeks. Before 3 months of pregnancy, in first trimester itself, registration have to be happen. Otherwise, that will be some actions will be taken from higher authorities if negligence happened, either to ANM or ASHA or MLHP. So once they got registered, we used to provide services. We will Asha used to they will give folic acid tablets to the mother till 3 months, and starting from the 4th month, mother is advised to take IFA, calcium, and B complex, and they are advised to visit monthly once to the PHCs for PMSMA, Pradhan Mantri PMSMA programs, Pradhan Mantri Matru Samraksha Yojana, Mantri Samraksha Abhiyan. So this program is carried out at subcenter and as well as PHC, pre-PMSMA, PMSMA, and post-PMSMA. 3 days this program will be happening in every month, 8th, 9th, 10th of every month. So as well as we will give, ANM will give TT first dose, second dose. For registration date itself, they will give first dose. For the confirmation of pregnancy by scanning also, if it is UPT is negative, but dates are more, we will refer the mother to that eligible mother to either area hospital or CHC for a scanning confirmation. Once the registration happened, everything, all the details of mother, we will issue one MCP card, mother child protection card. Every detail of mother will be written in that record, and their bank details, their personal details, everything will be registered. And every month, height, weight, and monitoring HV levels, monitoring RBS levels, everything will be recorded in that register. And the second trimester, what we will do, second TT they will be giving to the AN mother, and here again they are eligible for PMMEY benefit for first pregnancy and who have 2 female children. A second child also they are eligible. So this PMMBY again ANM will register this one, and they have right nowadays very advanced digitalization is coming. RCH portal will be there. Reproductive and child health portal will be carried out by ANM logins. So ANM will enter. Once entered, all the services have to be registered in that RCH portal. So second trimester, again I said the TT injection, and they have to come for either to the PHC PMSME program or to the 104s will come. Every month 104 FDP family doctor program will be there in every health center. So they can visit. If it is very long PHC from home to PHC, they can visit nearby sub health center also. Because that 104 day services day, doctors used to visit sub centers. So again, we do have a facility of hepatitis B, syphilis, HIV blood test also. We used to record. Then we will be referring, doctors will be advised for the TFA scannings as well as growth scannings in 8 months. And after the mother who completed 6 months and third trimester, we do GTT also in at field level. We are giving albendazole 1 tablet for second trimester mothers. So that's why we very carefully we will ask whether you have taken albendazole or not. Most of the time, the mothers who are going to private hospitals are benefited with their tablets itself. Iron levels, HB levels are good, but in government level also, if they are regularly they are using means HB levels are very fine. And if HB levels are very less in doing digital HB meter, we refer the mother to PHCs for Sally's method or any other kind of HB monitoring, or for CBC we will refer. If it is HB less than 8 grams or 9 grams in second or third trimester, medical officer will advise for iron sucrose. So iron sucrose again based on the required levels, they will give 2 doses, 3 doses. Before giving these doses, they will be giving test dose. So this is about the services during 9 months. And if mother is high risk, so high risk most of the time, any kind of fetal edemas in the third trimester or any bad histories, bad obstetrical history, post LSCS mother, short stature mother, or negative blood group mothers, and any kind of issues, twin pregnancies also, all will be considered as high risk. So high risk we will be preferring. We have MLHP app also. We have to give counseling in front of husband and mother-in-law along with our PHC supervisor and public health nurse. I will show all the images later on coming slides. So this is about during pregnancy. So the mother can carry this pregnancy MCP card up to 5 years of their own child. All the details will be entered in this record itself. Coming to child. So child, once mother delivered a child, either male or female, our Ashas used to visit to that hospital. If it is normal, Asha will go. If it is high risk LSCS deliveries, ANM and Asha will attend to that birth. Then after once mother is back to home, we do have a HBNC home-based newborn care visits as well as postnatal visits till 45 days. There are no home deliveries, so HBNC visits will be like 6. So in during HBNC visits, Asha used to carry weighing scale and all the parameters which they got from the government. So they register all the details in that record. PN visit, HBNC visit, record chart will be there in that MCP card. Then as per universal immunization program, this as per immunization schedule, all the children are administered with vaccine immunization doses based on that. So every month, if we this month 4 Wednesdays, 4 Saturdays are there, means all first 4 Saturdays, first Wednesdays will be routine immunizations. We do have 4 points covering all that. I have 20 villages, so all 20 villages, one point will cover 5 villages. Like that, we will decide. But this again, immunization point should be either in Anganwadi center or health sub center or in a school or in a temple. Should not sit in front of houses or in front of or in any kind of states to avoid the vaccine failure, because there should be no direct sun exposure. Then coming to the Saturdays, all 4 Saturdays will be outreach, going interiorly to the villages. So for fifth Wednesday or fifth Saturday means there will be no session except in the PHC level point. Then next one is, if somebody is getting bored, they are writing something on this matter. Then coming to the again for MR, once they complete 2 years of vaccine, we will advise for 5 years of TT dose and 10 years of TT dose. That's all. But nowadays we are informing the mothers to keep that record safely, because when I joined, PCV vaccine was not there. Nowadays PCV1, PCV2, PCV booster we are giving to children, and even adult BCG, excuse me, adult BCG vaccination program also started in Andhra Pradesh. For all eligible BCG vaccine, we are giving BCG vaccine to adults also. Then second one, neonatal and infant healthcare services. I said all HBNC visits we do. And I want to mention here vitamin A every 6 months from 16 to 24 MR2 dose. They'll give vitamin A second dose. Till 5 years, they will give every 6 months vitamin A. And IFA, I want to mention here iron folic acid. Every Wednesday and every Saturday, all mothers have to give one spoon, this iron folic acid syrup. We will give to the mother. They have to give 1 ml of IFA syrup to their children. Previously, it was given in Anganwadis, but nowadays, neglected mothers or neglected or absentees in Anganwadi. So, Ashas are directly giving IFA syrup to the mother. Then childhood and adolescent healthcare services. So for any child having fever, cold, cough, or any vomitings, diarrhea, at the center, we are giving treatment to them. Sometimes we do teleconsultation through eSanjeevani, and if beyond that we were unable to treat, means we refer directly the case to either PHA or to the area hospitals to pediatrician. Then family planning, contraceptive services, and other reproductive healthcare services we have. We don't insert the property, or we don't do any property removals, because in Andhra Pradesh, most of the type subcenters are type B. Subcenter type A can do deliveries also. Normal deliveries they can carry out also. In subcenter type B, certain types of services should not be done. And this Antara injection or Mala N, Mala D, or this one EC pills, condoms are supplied through Ashas to public, and tablets are supplied from ANMs to the ECs, eligible couple. And we do recently, Andhra Pradesh has launched every subcenter and PHC should have a previous ORS corners. You might have heard. Nowadays, family planning corner also have to be mentioned in all centers, because representing what are all the types of temporary family planning services are available should be displayed in all centers, which is named as family planning corner. Next, management of communicable diseases, including national health programs. All national health programs days we used to conduct. Most of the time, communicable diseases are like malaria, dengue. In field village level, if we do if we educate like 1 lakh time also, some people will never change. But still, who will be sufferers means healthcare workers only were the sufferers, because higher authorities will focus on us only. Why can't you educate them? Why can't you give some kind of suggestions to them? Because no, public will not listen to our words. They carry what they want to do. See, for example, if drainage water is coming from bathrooms or toilets in front of their houses, we suggest make some kind of pits in front of your home and close it with some kind of cement walls, but they will not listen. Still they continue. They have all some kind of stigmas, and they feel they are having some kind of bonds. But still, what can we do? I will show some kind of pictures later slides. And management of common communicable diseases and outpatient care of acute simple illness and minor ailments. So for per day, our target is 20. What happened, this hypertension and diabetes patients, I have 215 both HTN and DM patients. Among them, only 50 to 60 were under treatment in private hospitals. Because no, certain people they tell, my body is not connecting to government tablets. I'm getting this type of problems. I'm getting this type of problems. Like some kind of they do some kind of psychological complaints. If the tablet is working also, they will not accept. So we will mention them to okay, if it is acceptable with private, you can go. And but if the patient is safe, what is there? So that's why we suggest them. But most of the time, all the public population at a village level are coming to our health and wellness centers for follow-ups. Then these minor elements, I said, we have target, but many public used to visit our health and wellness center for any kind of minor element problems. And if any kind of follow-ups, from discharge from tertiary or secondary care of hospitals, we do again go for a teleconsultations through e-Sanjeevani again. Screening, prevention, control, and management of communicable diseases. I said we have last year we conducted house to house NCD survey, non-communicable disease survey. What is RBS level range? What is the hypertension level age? If the patient is already diagnosed DM or HDN, yes, we have like how we conduct research, right? Like that, we have all the demographic data in that mobile app. So we will register. If any new case identified, also we will register in that app. Care of common ophthalmic and ENT problems. So basically, we have like antibiotic drops for eye and ENT problems. If it is any serious issues, we will refer. We do have referral book also. We refer directly to CHCs for to consult specialist. Expanded range of services, basic oral health care. So oral health care, if they have most of the time, public, these villages used to do chief BT leaves. So they say they go for labor works, no? So they want to swallow that saliva, so to avoid dehydration. So public used to use, even males also most of the time here. But along with this betel leaf, they are taking some kind of tobacco powder, which is unhealthy for their them. But even though we educate on tobacco day, or when we go to that village in any kind of meeting, but still it is continuing only in many villages. Until unless they are getting sufferer, they are not accepting, but still we are educating. Again, for oral health also, we are referring if any kind of bad histories or any kind of oral cancer screening, if we have any queries like any scales are present, if root canal is advisable, if the patient is getting severe pain, we are referring to dentist. Coming to elderly and palliative healthcare services, literally speaking, health and wellness centers are only benefited if except this AN and children, benefited for elderly. Really, they are blessed. See, they can't travel, they can't walk to long distances. So at least to relieve from the pain, get relief from the fever, cold, cough, or any kind of minor problem, Ayushman Arogya Mandirs are really for elderly, they are blessed to utilize the services from here. Emergency medical services, not all medical emergencies we are treating. Basic, if any injury happened, doing dressings. See, for one day, I want to mention one example. One thing happened. A dog bite case came to our health and wellness center. I do have a refrigerator, but I won't carry TTs in that refrigerator. God's grace, that day was the routine immunization day. My ANM brought TT injection in that vaccine carrier, adult TT. So that patient told, I'm coming from 10 kilometers. You're telling nothing is, I didn't told, I can't do anything here because ARV is not available in health and wellness center. They have to go only for PHCs. But I can give at least TT, and I did. I educated him to wash with soap and water, and I told him to be comfortable. If he have any other kind of side effects or any other problems, we can give treatment for incidence, not for the continuation. But at least he is satisfied with some injection. So I given TT injection, but I can't give any other injection saying that this injection is enough for dog bite. But for their satisfaction, at least at sub health center level, we have to give certain treatments, and then only we have to refer. Screening and basic management of mental health elements. So most of the time, it is very difficult to carry out a mental health patient at tertiary level hospital itself. But here, I can say I can give health education properly to the public with regard to mental health. Recently, Suicide Prevention Day happened. So all wellness days we have to conduct like any kind of program camp for giving health education and to aware about these health days. Mental health problems, rarely we can see, but if they are, we do follow ups whether they are consulting the psychiatrist or not.